On Saturday, Rachel Levine, the Assistant Secretary for Health in the Department of Health and Human Services, who is the highest transgender individual in the Biden administration, spoke at the annual Out for Health conference at a gathering organized by health science and medical students in Texas. Now, prior to this speech, she went on NPR on Friday and made this comment about the issue of children being treated for gender dysphoria.
There is no argument about the value and the importance of gender-affirming care. There is no argument.
Well, joining me is someone now in the medical profession that I believe is among many who does have an argument against this. Here to discuss this topic is Dr. Quentin Van Meter, a pediatric endocrinologist and president of the American College of Pediatricians. Dr. Van Meter, welcome back to Washington Watch.
Thank you very much. I'm glad to be of help to discuss this particular thing that I also heard on the news.
So is there no argument about the value and the importance of gender-affirming care?
Well, I would beg to differ. We have spent a great deal of time and effort, a number of individuals responding to the HHS Biden administration regulation number 1557, which is an addendum to the Obamacare Affordable Care Act. And we have spoken eloquently and consistently and in large numbers against the mandate to affirm socially, medically, and surgically children who with gender dysphoria because of the known demonstrated harms of this particular set of treatments. Even as simple as social affirmation has been clearly shown to have detriment to the child. There is no scientific evidence that is really been published. There are studies that have been published, but they are deeply flawed by being convenient samples from activist groups. And the actual clinical science from Sweden, which is the only place that's published true population studies, that is every single transgender patient in the healthcare system, they have found that there is absolutely no long-term benefit for medical and surgical and social affirmation. So there is the science. The American Academy of Pediatrics, representing 66,000 pediatricians, has published guidelines that indicate affirmation is the only way to go and that any kind of counseling is unethical. This has been torn to shreds by Dr. James Cantor immediately after those standard of care was produced by the American College or American Academy of Pediatrics. So the pediatricians that I speak to, and as an endocrinologist, I talk frequently about many other subjects and give CME talks and indications for treatment of various other kinds of conditions. And the pediatricians afterwards will come up to me and say, hey, what about this transgender business? I'm very uncomfortable. Is any of this real? So there is no consensus. If Dr. Levine suggested there's a consensus, it's a grievous error.
Dr. Van Meter, let me ask you this question because my understanding, correct me if I'm wrong, it's not just conservatives who are not in line with this, but even those who are, I would say, pro-LGBTQ question whether or not this is the best way forward, driving these kids to hormone treatments and surgeries. Is that correct?
Absolutely. There is a beautiful organization called the Society for Evidence-Based Gender Medicine, or SEGM, and I would like your listeners and viewers to go online and look them up. They are a broad spectrum of political opinion individuals who do not use politics at all in their deliberations and their evaluation of science, and they have condemned affirmation in minors with very good background and literature that supports their theory. So this concept that there's no opinion against this in the medical community or among pediatricians is absolutely an untruth.
Again, Dr. Van Meter, the studies that I have read, the research that I have seen suggests that these adolescents that are going through, almost what I call like the black hole in space, kind of going through the reentry process where everything is just all discombobulated, 80% of them come out on the other side okay if we just kind of walk with them through. In fact, the process, as I understand, has been called just watchful waiting. Just helping these kids make the normal the normal journey into adulthood.
Puberty is not a disease state. It's a very difficult time for pretty much everyone who goes through it because of physical changes that are part of going from a non-reproductive individual to a reproductive adult. And every one of these children, there's no question there is suffering going on, and we have deep compassion for these kids. But watchful waiting sort of sounds like you're not doing very much, but indeed it is extremely important to support these kids with, their families and their whatever faith background they may have, or whatever counselors are working with them to tell them, hang in there, that you are deeply upset about something in your life, and what we would like to do is work on those deep issues that are beneath the surface, instead of putting the Band-Aid of transgender affirmation over the top of a volcano and then watching it erupt later on. So the real compassionate treatment is to not put that Band-Aid on the top, not to make it something that it clearly is not, has no biologic basis whatsoever, is a mental health issue completely and utterly. Despite the fact that people don't like to say that, that's where the truth is.
So, Dr. Van Meter, is this an issue of science and medical issues, you said mental health issues, that has been hijacked and turned into a political issue?
There's an ideology that's on the side of affirmation that is passionate. Now, I don't think that anybody on the other side of the issue, the affirmation crowd, are mean-spirited in terms of wanting harm for their patients by affirming them. I think they firmly believe what their ideology says, but it's not based on science, and we cannot continue to treat children or have things happen on the basis of ideology. We've been there before in the 1970s with Dr. John Money at Johns Hopkins, and the outcome of that was disastrous. And that program was shut down and buried. I was actually there in training at the time that this was going on. And so we've had, this 20-year kind of quiet period where all of a sudden, as of about 2010, there's an explosion, easily 250 to 500 times greater number of patients presenting with gender dysphoria. And so that in and of itself proves that there's no genetic basis for this. It's the suffering is not because society is not accepting this as an option. The suffering is because beneath the surface, these kids, even in their convenience sampling, are shown to have an incredible amount of depression and anxiety at baseline. And that is in the studies that they have published that show that there is improvement. There is no improvement when you actually analyze their data. And there are letters to the editor frequently that can take these studies that are published to task. So right there, that tells you if there's not a consensus, there is a significant concern on the part of scientifically based physicians whose idea is first and above all, do no harm.
Dr. Van Meter, final question for you. Parents that see the signs of this in their young children that are making their way through puberty into adolescence, what should they do?
They should find some good sources. And I think if we could send them all to SEGM, that organization, they have a beautiful resource book for the parents to kind of go through. The parents are being bullied. I mean, the mantra of what would you rather have, a trans female or a dead boy, is just, it's bullying. It's not based on anything other than harassment and making the parents feel so badly that if they don't acquiesce and go along with the mantra, they're going to have a dead child. And that is absolutely and utterly despicable because it has no basis in truth.
Dr. Van Meter, thank you so much for joining us today. Very enlightening, and now we know for a fact that there is not consensus on this issue. Thanks for being with us today.
Thanks for having me.